Parents, if your child has suddenly developed an onset of motor tics, anxiety, OCD, brain fog, exhaustion, gut challenges, and is getting sick all the time constantly, and you find your family on an emotional roller coaster where one day it's okay, the next day it's definitely not, you can't seem to find a root issue or a cause for it, and you're not really able to figure out what's going on and how to help your child, this can be extremely concerning for you as a parent. Especially if you're noticing these symptoms, particularly with like a very quick onset, here and then gone, symptoms where it's truly up and down every single day with the intensity, then it is most likely a complex condition that we call PANS or PANDAS. You might have heard that before and not really known what it means exactly, but I'm going to explain to you and break it down for you in a very simple way and explain what you can do to help your child when they are affected by this. So today we're going to break down the neurological impacts of PANDAS or PANS, what it means, how it affects the body, and drug-free solutions for you as a parent if this is impacting your child. It has become more and more common in the past 10 years that younger and younger children are coming down with these infections, like chronic infections. And this stress begins to accumulate and it begins to compromise the immune system. So kids are getting sick more and more frequently. The immune system is being lowered and they're getting more and more stressed out. The nervous system gets impacted and even the psychiatric system also gets impacted. So this is impacting 3 different systems of the body: the immune system, the nervous system, and the psychiatric system. So then they're getting that mental disorder type of impact as well, where they seem like they're going a little crazy almost. So you can't just address one of the symptoms. You can't attack all of it at once because this would be incredibly hard. So you might seek out your general practitioner for this issue, the neurologist, the gastroenterologist, the psychologist, and you just might not be getting the answers that you're looking for on how to really root cause address this condition. What we've seen in our clinic with taking care of these cases is that the order in which you address these systems makes an impact on the way this child heals from the condition. So you need to know which system to attack or protect first. So let's start with the definition of PANDAS and PANS. PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infection. Now that was a lot of big words. So what does that even mean? It means that we see it in kids most commonly, so younger and younger kids nowadays. And we have an autoimmune component, a neurological component, and the final 2 words is that it's triggered by a sudden immune system component or a streptococcal infection or some sort of infection that affects the body. Since we have overused the use of antibiotics, which have depleted the guts of these young kids, and sometimes other medications as well with those side effects, our kids' nervous systems today are a lot different than they were 20, 30 years ago. They're starting out a lot more stressed at an earlier age, and they're a lot more dysregulated at younger ages too. So this creates an opportunity for infection to occur since the system is already weakened prior to the infection. So what's interesting to us as pediatric chiropractors who see a lot of kids, we see a commonality in a lot of these cases, these PANDAS and these PANS cases. We see something called dysautonomia happening before the strep infection pops up. Dysautonomia is a fancy term for nervous system stress and dysregulation. So a dysregulated child, they're already here and there and all over the place, not sleeping well, not pooping well, not eating well, very picky with their eating, you just having constant tantrums, all these different issues, and then they get sick, it is going to affect them a lot more than your regular healthy maintenance child. So what we see, this nervous system stress and dysregulation, this happens first. This then opens the door for the strep infection to get in and compromise that immune system. It's an opportunistic infection. And this sets up shop, it sticks around, and it gets even worse. And then it comes back around and comes into the nervous system and winds up that nervous system tighter and into a more tense state. And that's where we see those things like motor tics and muscle pain and tension come into play. So the order goes like this: neurological, then immunological, then neurological again. So it comes back to the nervous system. Traditional medicine does not look at the order of this. They look at all the different things happening and they try to target all of them at once, like putting out all those fires at once, which is great, but we're not addressing the root issue. What came first? So we want to target the infection. That's great. And that's what standard medicine will do. They'll target the infection or the immune system to try to get rid of the infection. But when we look deeper, we see that the first stressor is the dysautonomia and the dysregulation of the central nervous system. And that creates a weakened and susceptible immune system. So we don't want to be weakened. We don't want to be susceptible to these conditions. So with PANDS, the definition for that is pediatric acute onset neuropsychiatric syndrome. So this is more associated with PANS, which is influenza. These are the more conditions associated with PANS: influenza, pneumonia, RSV, or even sometimes head trauma or concussions or food poisoning that attack the weakened immune system. But the same point underlying is that the weakened immune system comes from that dysautonomia that I was talking about. The reason that this happens suddenly is because you're adding inflammation to an already inflamed body. So we're going to show you how this presents in a child physiologically. So what we have here is what we call our heart rate variability scan, which is one of the 3 scans that we take in our office. So if you look, I've circled the 2 bottom words underneath the graph. We have our sympathetic side, which is this side, and then we have our parasympathetic side, which is this side over here. And you can see that outlined at the bottom of the page. And that little white dot there is actually what shows us where that child is plotting on this graph after we take their pulse for about 3 minutes. So this child, this is actually a case of PANDAS and PANS in our office. That child's little white dot is on that sympathetic side. That sympathetic side right here is the fight or flight side of the body. And guess what that is correlated with? Dysautonomia. And so these kids are stuck quite literally in this state. And it takes them a lot of time to get back into that middle green area where we want all these kids to be. So this is what I'm going to explain about this. So with these kiddos, we're seeing that they are stuck in this dysautonomia state. They're stuck in this fight or flight. And a lot of parents can see that they're stuck in this fight or flight. They see these signs early on before that sickness occurs. So the central and autonomic nervous system is the root of the tree of these issues. Then you have things like the trunk, which is the gut and the immune system. So when we see on this HRV scan that the kiddo is stuck in that fight or flight and in that sympathetic storm of fight or flight, their body is in a worse state to fight off infections. And it actually interrupts their healing process a lot more. So they're already inflamed, they're stuck in fight or flight, and then you add this infection and then that storm just happens. So the next step that we do is we actually address bringing that body back into that parasympathetic state, which is the rest and digest state, so that they're better able to adapt and heal and be resilient when they encounter these infections. Because you can't hide from these. They're going to be everywhere. Germs are pretty much everywhere. It's whether that child responds to it in a severe way or not. That is what you have to address, is their adaptability. So we address things in our office like the gut, the nutrition, the immune system, and all these different things, which is where we co-refer with a functional medicine doctor to make sure that they're getting all the lifestyle factors along with the care that we're providing in our office. So our job as pediatric chiropractors is to get that nervous system from flight or fight to rest and digest so that they can adapt better, and then we can start addressing the gut and the immune system and all the different things like supplements that help these children really recover, because you can't just recover with one aspect. You have to recover with all of them. And a reminder that the order is more important than addressing all the things at once. You want to address that nervous system first. So if you're a parent who's tried the supplements, you've already tried the diet changes, you've tried all the different ways of parenting to try to get your child out of that fight or flight state and in a calmer state, your child's probably improved a little bit, but has not gone all the way back to being who they were before this condition happened to them. So there's more to address here. There's a missing link. We have to unlock that nervous system first before lowering that inflammation through lifestyle. So if this sounds like your child, please give us a call. We have seen cases like this before where we've really drastically helped them get out of that fight or flight state. And then we brought all the things in and the specialists in to help them get that lifestyle that's lower in inflammation, getting them through the sickness is easier and preventing them from getting this sick again. So let us know if this can help you. Let us know if this is someone that you know, and we will definitely connect you with someone near you that specializes in what we do as well.